The culture finally comes back, and there's multiple antibiotics that are susceptible. One antibiotic has the lowest MIC. So which one do you choose? Most people immediately pick the lowest MIC, and often that's wrong. Let's say your patient has an E. coli urinary tract infection, and the susceptibility comes back showing macrobid, MIC of 16, Bactrim, MIC of 16, Cefnir, MIC of 1, and Cipro, MIC of 0.5. All of them are susceptible. So which one do you choose? The MIC, it's not a ranking system. Let that sink in. A MIC of 1 is not automatically better than a MIC of 16. The breakpoint for each antibiotic is different. And just so we all know, MIC stands for minimum inhibitory concentration. Basically, it means the lowest concentration preventing visible growth in a lab. Lowest amount of med that's needed to kill the bacteria. But MIC is only in reference to individual antibiotics' breakpoints. And a breakpoint is what determines whether a strain of bacteria is classified as susceptible, indeterminate, or resistant. If all of the report shows susceptible, all those antibiotics could work. So instead of asking which MIC is lowest, we need to ask, what is the infection? Is it a UTI? Is it pneumonia, bacteremia, meningitis? Where does the drug concentration need to go? Macrobid, amazing in urine, horrible in the bloodstream. Oral or IV, can they take it when they go home? And then stewardship, do we need broad spectrum or can we do something narrower? We need to remember that we're not treating that culture report. We're treating the patient in this moment with this infection, not that report. So for a simple outpatient UTI, macrobid of 16 is going to be a way better choice than a broad spectrum antibiotic with a lower MIC. Why? Because the infection site matters. We're not going for lungs, we're going for urine. We're not going for the blood, we're going for the urine. So the next time you look at a susceptibility report, do not ask which antibiotic has the lowest MIC. You need to ask which antibiotic is best for this patient with this infection in this situation. Because lowest MIC does not always win. The key takeaways here. MIC tells you if the door opens. It does not tell you what room you're walking into. The best antibiotic is not always the strongest antibiotic. And we're not treating the culture, we're treating the patient. In short, good clinicians read the culture. Great clinicians look at the whole story. Because the MIC is just a piece of a puzzle, it's not the answer sheet. The patient is what answers the rest. And that is how you think beyond the bedside. Thank you.